Coming up on American Medicine Today, joint pain, liver damage, Alzheimer's, and Parkinson's could all be the result of too much iron. Dr. Christy Sutton shares what undiagnosed iron levels could lead to with her latest book, The Iron Curse. Then Margarita stays incredibly active in resort hospitality, but terrible back pain almost put an end to her career. After seeing multiple doctors with no relief, she found the Bonati Spine Institute and is now happy to be back to work pain-free. Finally, Biden is forced to declassify White House intelligence on the origins of COVID-19. Dr. Salvatore Giorgianni Jr. joins us to uncover the truth behind the virus leak. Do these declassified documents support their original outbreak narrative? Find out coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon Dr. Alfred Bonati. So joint pain, liver damage, diabetes, Alzheimer's, Parkinson's, and even heart disease, what do they have in common? Well, they could all be a result of undiagnosed and untreated high iron levels. Joining us to discuss is Dr. Christy Sutton, author of the upcoming book, The Iron Curse, and the creator of the Iron Curse webinar series. Thanks for joining us, Dr. Sutton.
Thank you for having me.
Now, I've never heard about high iron levels. I've only heard about low iron levels.
I never heard of, and there's a term for it, right, Dr. Sutton?
Yes. So hereditary hemochromatosis or just non-hereditary hemochromatosis. There's other categories of high iron as well, but the ones that I see most common are hereditary hemochromatosis, where you have the genes, and then non-hereditary hemochromatosis, where you don't have the genes for high iron, but you develop high iron for just environmental reasons, such as liver disease or consuming too much iron or something like that.
And I understand that you personally had health issues for many years, and then you wrote your first book, I believe it was called Genetic Testing. And through your process and journey, you realized your husband had been having health issues.
Wow.
And you, I believe, and correct me if I'm wrong, discovered it was because he had high iron levels and everybody missed it. Is that right?
Yes, correct. When I was writing my first book, Genetic Testing, Defining Your Path to a Personalized Health Plan, I discovered why I kept telling my husband, you need to donate blood, because he would bring home his blood work from his primary care doctor, and I would see, his ferritin was elevated and his liver enzymes were high, and his doctor wasn't saying anything about it. And then ultimately, I realized, okay, you have hereditary hemochromatosis, and we went through the path of getting him officially diagnosed, which was a learning experience because we started with a gastroenterologist, and, I gave him the genetic information in the labs, and they just said it. They basically didn't take that seriously as a diagnosis, and they thought he just had fatty liver, and they misdiagnosed him with autoimmune hepatitis. And then we went down this misdiagnosis rabbit hole, but eventually we got out of that and got him the proper diagnosis. And then from going through that, I got much more savvy about diagnosing my other patients. And I discovered that, there's a lot of people, there's just a epidemic of undiagnosed high iron out there. And then I realized that a lot of doctors not only are not diagnosing it, they don't understand it and really significance and how important it is to address it early.
So why isn't there some sort of high iron test? It seems like that should be the simplest way to check for something like that.
The most common labs that get ordered are a lipid panel, which is cholesterol, triglycerides, a CBC, which, looks at hemoglobin, hematocrit, red blood cells, which sometimes high iron will pick that up. That's not really how you diagnose it. And then usually they always order like a CMP, which is looking at liver and kidneys and electrolytes. But often doctors will not order iron-related labs, or if they do, they don't order what I would call like the full iron panel. So the full iron panel includes the ferritin, the serum iron, the UIBC, the TIBC, and the iron saturation. And sometimes doctors will maybe just order an iron, serum iron, or maybe they'll just order a ferritin. But you really need all of those, especially with a CBC and CMP, to see like if the liver enzymes are high. So the short answer is it actually is quite easy to diagnose. And then if you have those genes, then you can very quickly screen the population for who has this problem. The longer answer is that doctors are either not ordering the labs, or in some cases, like my husband, for example, the labs are blatantly out of range, but they're being ignored. And then sometimes I'll diagnose people and I'll say, you have a problem, and they'll go to their primary care doctor, and the primary care doctor will say, oh, no, that's fine, even though the labs are out of range in a way that shows that they have high iron. So there's just a kind of a perfect storm of different things. And there's also some myths about hereditary hemochromatosis. Like there's this myth that if you only have one gene, you're a carrier and you can't develop hereditary hemochromatosis. And that's a really dangerous myth, because the majority of the people that I see and diagnose, including my husband, only had one gene.
Explain to me sort of the how and why high levels of iron have such a destructive impact on your health.
Right. Okay. So iron, like you mentioned, iron is extremely important for health. We will die without iron. And iron deficient anemia has really killed and is still killing it. A large number of people, myself, I've had low iron deficient anemia. It's very common. It's the number one nutritional deficiency. Because it is so common, and because iron is so important for survival, basically evolution found a way to create this gene where you absorb more iron, and that's the hemochromatosis gene. And that is a gene that originated in a Celtic Viking ancestor, and so it's extremely common in the Northern European countries, but really about 30% of the world has one or more of these genes. The problem is that we live in a world where low iron, while it's still an issue largely because people either have a malabsorption issue or maybe a GI bleed or pregnancy or menstrual bleeding, there's a lot of reasons to be low in iron. But we live in a world now where low iron is not as common because, processed foods have iron added to them. You can get iron in supplements. It's just easier to become higher in iron. We also live in a world where people live to be older. So as you get older, especially, men and women, postmenopausal women, they're much more likely to get high in iron just because they haven't, they've had more time to accumulate more iron, unless they've had a surgery or, major bleeding, menstrual bleeding, even a bad nosebleed can significantly low iron. The problem is that low iron is very bad and extremely dangerous, and there's lots of problems associated with that. The other side of the coin is high iron, which high iron, it will accumulate in your liver and cause liver problems. There's a 200 times increased risk for liver cancer with hereditary hemochromatosis and hemochromatosis. It will accumulate in your gonads and cause infertility for men and women. So it'll decrease testosterone. In fact, most people are diagnosed with a symptom of high iron, like they'll be diagnosed with low testosterone or fatigue, or they'll have hormonal problems because it'll accumulate in your pituitary gland. And, if you're having problems with your pituitary gland, then you're going to have thyroid problems, sex hormone problems. Even if you develop high iron at a young age, which actually does happen with people with those genes, I've diagnosed that, then you might be shorter in stature. It'll accumulate in your heart, causing cardiovascular disease, in your pancreas, causing diabetes and insulin resistance, in your brain, causing Alzheimer's, dementia, basically any neurological problem that you might be genetically predisposed for, you're more likely to have it if you add high iron to the equation. So bipolar, schizophrenia, depression.
More people need to be aware, so thank you for coming on and letting the public know so that they can keep an eye on it. Dr. Christy Sutton, thank you for being on the show.
Doctor.
Thanks. Bye.
Make sure you stay tuned. Coming up after the break, a story of recovery.
I went to Dr. Bonati and he went ahead and looked at my pictures. He told me, you have pain here, you have pain here. And I was like, yeah, absolutely. I'd been to others, but he was a doctor that didn't want to fillet my back open like a fish and do like open spine surgery because everybody else wanted to do that and I was not having it. The anesthesiologist who was working with me, I was like having a conversation with this guy, and then I was watching on the monitor as Dr. Bonati is fixing my back. I really felt like I was in good hands.
Visit askbonati.com. If you ask anyone who works with Margarita Jepes, they will all tell you she's the hardest working woman around.
I am from Medellin, Colombia, South America. Came to the United States over 40 years ago. I work for the Trademarks Hotel here in St. Petersburg Beach for 31 years. I'm the Director of Banquet Operations and Logistics. I get to work between 4 and 5 o'clock in the morning. I need to check all the meeting rooms, meeting space, that everything I've done the night before. I'm in charge of all the events, activities, and anything that has to do with the conferences, all the events at the hotel. I'm on my feet, an average of 12, 15 hours a day, 5 days a week, sometimes 10 days. It all depends on the business of the hotel.
But her degenerative pain turned the simple tasks of just going to sleep and waking up into a nightmare.
My pain started about probably 25 years ago. My pain was in my lower back. It felt like, it's kind of funny to say that, but my mother used to use this expression, it's like a chihuahua was attached to your back, like a dog bite. And nothing would take it away. No heat, no cold, pills. It was excruciating. Continuous pain. When I would have to get out of bed, I would have to go like this, wait there for a few minutes for my back to be in comfortable position. Then I'll have to grab this arm like this and go, oh, like this. And I couldn't turn like this. I'll have to be like a little bit, pick up my legs in here, wait a few minutes. Then I'll have to, little by little, do one leg, then the other, and then I'll be like, oh. And then I will sit in this position for a while, take a deep breath, and I'll have to go like, and then straighten out. But then when I get to this place, then I'll get up and I'll be like this. I couldn't be straight, so I have to go like this to the shower until I reach the shower. When I reach the shower, I have to put my hands like this and then get the hot water going, and then to be able to stretch it out and to be straight. And then when I was in this position, the pain was excruciating. After
multiple years of being told her pain was a burden that she'd have to face for the rest of her life, Margarita sought out different physicians in an attempt to reduce her pain.
I visited several doctors, visited 2 spinal specialists, pills. That's the only thing they gave me, the only hope. Then I went to get the shots in your back. And I always ask, is there a hope for this? There's surgery? No. So what does this mean? I have to live with this pain? And that's the answers they gave me, yes. There's nothing I could do.
But after a phone call one day from her brother, her life changed.
My brother is a surviving cancer patient from leukemia. He has degenerative bones from all the medicine. He could barely walk. He was in a wheelchair, and when he went to his oncologist to visit him, he said, I want you to go and see Dr. Bonati. He did surgery on me. It's incredible. You will not believe the results. It's non-invasive. You'll love it. After I saw my brother, amazing results. He did 2 surgeries on my brother. I said, I'm next. Take me.
Consultations at the Bonati Spine Institute are comprehensive and performed personally by one of our world-renowned surgeons. Once a thorough physical examination is complete, followed by an evaluation of symptoms and an extensive analysis of imagery, a surgical plan is custom-tailored to target the source of the pain.
Dr. Bonati came and saw me after he reviewed my MRI, and he explained to me, he said it's a simple surgery. We do one side first, then the second side. We'll do this procedure right here. When I walked into the surgery, I see all these big cameras, and it's not your conventional flat bed doctors have procedures in. It's like you're kind of like sitting face down, and you see the camera and you hear the doctors talk, and he's continuously talking to you. Does it hurt here? Say yes or no. Do you feel anything? Are you totally awake and know what's going on?
The Bonati Spine Institute employs conscious IV sedation during its procedure to ensure patients remain in communication with not only their surgeon, but the rest of the surgical staff so they can make sure their pain is alleviated.
The difference between conscious IV sedation and general anesthesia is that we will be able to give the patient a level of comfort using intravenous agents, but they will still be aware enough to tell us what they're feeling. And it's very important to do that. And we've been doing this method at the Bonati Institute for decades. And Dr. Bonati is the pioneer behind this all. The reason is it allows the patient to express exactly what they're feeling at that moment right on the table. The whole idea is to get them to pinpoint the exact location, and it's without question the best way.
Because precision tools and techniques are used when performing the patented exclusive Bonati Spine procedures, time spent recovering is significantly reduced.
The recovery's been amazing, totally amazing. From the time I got home until today, from my first surgery, it's been now 3 years. I cannot believe I went through all those years with that pain. And now the things that I do, I am a person that I'm extremely active. I walk in my job 12 to 15 hours a day. I can lay down on the beach at the pool with no problem. Going home, the recuperation was just be calm, lay down, walk. Absolutely, you have to walk. You cannot just sit there. He doesn't want you to become you have the surgery and just kind of like, oh, I had this back surgery. No, you have to move. Keep moving. The more you move, the more you walk, the quicker your recuperation is going to be. Your recovery is very fast. It all depends on you.
Margarita is back to her active lifestyle and making sure her clients and resort guests are feeling just as great as she is.
There's no restriction of doing anything. The one activity that I loved to do before that I couldn't do, that I always kind of like made excuses, was to lay out at the pool or lay out at the beach or go camping or spend the night at someone's house in a regular bed. Those were activities I was not able to do. And I tell everybody, don't be scared. It's amazing. They're not putting a rod through your back. They're not putting any pins in it. They're working in this small little incision this big. When a lot of people ask me about that, they ask me about how was your back surgery. I tell them it was the best thing I ever did. The best thing I ever did. With all the procedures and all the technology that they have right now, the non-invasive procedures, this scar is this big. I recommend the Bonati Institute anytime, anywhere, to anyone. Here, in other countries where I travel, amazing. From the professionalism of Dr. Bonati, the nurses, the care. When you go there, the way they treat you from your first appointment, from the concierge when you get there. They call you, how are you doing? Are you feeling better? The follow-up they have is amazing. They've sent me an email like every 6 months. How are you doing? How are you feeling? I just think you should not stick to that one opinion that one doctor might give you. What Dr. Bonati has done to me and to many patients is giving us back things that we never were able to do. Gave me a hope. I was thinking I was going to be 60, 70 years old, taking pills and being in pain all the time. To me, be able to work the way I do, the quality of life that I have, that I don't have to ask for 15 pillows every time I go to a hotel, that I can sleep in anywhere I want to. I can sleep on the floor if I want to, on a sleeping bag where I was never able to. It's amazing. So go with the procedure. There's nothing to be fearful about. It's a quality of life. That's all there is. It's a quality of life.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
And when I got up off that table, it was like, like a reborn again when I was able to walk off that table and walk out and go for lunch.
And was recovering, I didn't feel anything. The pain that I was suffering is gone. I can go back to work in like 3 days.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
That afternoon, when it was done, I actually felt so much better already.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, So 6 days, and everybody wasn't all like, didn't you just get out of surgery? I'm like, yeah, I feel great. And like, okay, let's see how you do. And I was rolling with everybody, and I'm in the advanced class. So that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. So, the House recently voted overwhelmingly to approve the declassification of all the Biden regime's intelligence on the origins of COVID. So what happens next? Will China finally be held accountable? Joining us to discuss is our friend and returning guest, Dr. Salvatore Giorgianni Jr., Senior Science Health Advisor to the Men's Health Network. Thank you for joining us, Dr. Sal.
My pleasure. Thanks for having me back on the program.
Why don't you tell us about this bill and the unanimous vote to pass the declassification of COVID intelligence? And what is it that you understand?
This is a very important move by Congress. We'll see how that plays out in the real world. But then also we have the next stage, which is once the documents are declassified, there could be a lot of redaction. And it's not unheard of to see documents released where much of the information is blacked out. So I hope that doesn't happen.
Yeah.
And I hope what we are able to see, particularly in the medical or scientific community, is what the intelligence sources have uncovered and what the communications between our science branches of the federal government were and the political branches of the government. I think it's essential to understanding not just what happened with COVID, that's very important, but what can we do to prevent such a scenario from happening again? Because, Kimberly, the reality is there is a lot of biologic research going on all over the world in ethical players and some potentially not ethical players. And we really need to understand how to manage this, or better yet, how to prevent this catastrophe from happening again.
Anybody who sort of put forth that idea, that theory, if you will, that this virus was manufactured in a lab through gain-of-function research and then somehow was either intentionally leaked or got out one way or another, most of the main agencies now in the health industry are saying, yes, it's very, very likely that it came from a lab leak. And yet we're not hearing much about it from the media. There's no about face like, hey, you guys were right.
I don't know that we'll get an apology from anyone at this point, or maybe even when the truth is uncovered. And hopefully we will get to the truth. And that's sometimes an elusive but an important goal. And I think the science historically has never failed well when politics is inserted or religion are inserted on top of science. There's Copernicus, who was very much criticized and ostracized and penalized for pointing out that the Earth was not the center of the universe. Science needs to take the scientific process and it needs to follow it. The other thing I think is distressing, we've used this phrase, follow the science, as a euphemism for my data is the data, and you got to believe my data. And anybody from attorneys through plumbers who give estimates on work in your house knows that there are numbers and there are numbers. So I think, there's statistics and damn statistics. And I think we all have to be able to be a little more savvy when we hear the phrase, I followed the science, because just as in most human endeavors, when you get 4 experts in a room, you have maybe 8 opinions, if not more. So I think we have to be much more savvy and look at the nuanced arguments than just take these dogmatic positions at face value and say anybody who speaks against them is clearly doing something bad for society.
Even though it's already come out that many of these agencies are already saying, yes, it more than likely came from a lab leak, they're still sticking with the story that it came from a wet market, something about raccoon dogs. Can you elaborate on this? Because I saw it and I just saw, why are we still going back to this wet market theory?
Well, I've never seen a raccoon dog or even a picture of a raccoon dog or one at the local pet store. I did take a look at them. They are indigenous to certain parts of Asia. They are essentially fox-like dogs, and they're wild, and I don't think they are domesticated. And it appears that the information about the COVID virus being found in these raccoon dogs comes from January 2020. That's quite a while ago.
Yeah.
So why it's coming out right now as an interesting point to consider, I think timing as well as information needs to be considered in doing your calculus about the truth. We all know that various animals can have COVID. They can be given COVID. They can get it from the wild. So there are lots of ways that these raccoon dogs that were found to have had COVID in them could have gotten it. And it may be from eating infected bats or something in the wet market to being having been in the animal labs as part of the experimentation. Don't forget, these gain-of-function research things use animals many times, use live animal models. So I don't know what's going on here. So I think we have to take that as an element, I think a rather small element in the calculus here. But I think the dominance of the information is going to come back to the point that I've seen a couple of times, which is when virologists and geneticists looked at the genetic code from the COVID virus, they found things there that were not things they believed could occur in nature. And that, to me, is a pretty compelling piece of evidence.
Right. And that was Fauci and his staff manipulating things to cause a bioweapon. Do you think Fauci will ever be held accountable, and anyone in China?
Well, that's two really different questions, and my crystal ball usually is very hazy, Kimberly. I apologize. But
that's okay.
I think Dr. Fauci has already been held accountable for his actions. He has not suffered any consequences, but I do think there are many, many people who have grave concerns. I was a bit dismayed. I will add parenthetically that my alma mater, Columbia University, is awarding him a prize on their anniversary year this year. And I think we're going to see possibly that not being repeated often. But I do think there is a doubt cast on Dr. Fauci's true veracity. So there's he told the truth, but maybe not the whole truth.
Right.
Holding China accountable, I think, is a much greater burden of proof. I think that has implications far beyond the domain of science. I would hope that even if there isn't the type of concrete proof that political leaders need to do these kinds of things and make those kinds of accountability moves, that there will be sufficient concern on the part of all, including WHO.
Right.
Including WHO, who has yet, if I understand correctly, has not listed this as an official pandemic. That you can and must be much more diligent in looking at the data and being open-minded to other opinions, not just the controversy at the moment.
Well, time will tell if anyone will be held accountable. I really hate the idea of rewarding people that were part of this whole debacle. But thank you so much for being on our program, Dr. Salvatore Giorgianni Jr. Thank you so much for joining us.
Anytime I can be of help.
Take great care. That wraps up this edition of American Medicine Today. Check us out next week, 4 p.m. Eastern, right here on Newsmax. And anytime, visit us on YouTube. Search American Medicine Today. If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.